So, hi folks, welcome to another Wellness Wednesdays. You all are like being an amazing audience from attending every sessions with us. So today we have Dr. Impana and Preeta. They are like specialists in family medicine and they have an overall experience of 10 years. They are like certified health coaches for us and nutritionists. So today we'll talk about everything related to headaches and migraine, what you should do, how you should do, and how if you are diagnosed with something like this, you should not just Google it and just go to a doctor or here we can get some best advices from doctors. So let's go ahead and we'll keep on a last cell, like towards the last of the session, we'll keep 10-15 minutes for the question and answer. You can post any of the things that you want to know on the Q&A section. We'll take it up at the end of the session. Thank you guys. We can start.
Yes, thanks Komal. So hi everyone. Thanks so much for tuning in. I know it's a very relatable topic, headaches and migraines. All of us have faced it some or the other time in our lifetime. But I'm Evelyn. I'm the founder of MyAva, and we're happy to have partnered with Onsurity for these sessions. So what MyAva is basically like a complete health and wellness platform for women. We look at chronic conditions like PCOS, thyroid, diabetes, and fertility, all of these coupled with teleconsultations and diagnostic tests. So we're happy to have kind of tied up with Onsurity for these Wellness Wednesdays. So without further ado, I think I'd like to introduce our speakers for today. So we have Dr. Impana, and who's a practicing family physician. I'd like for her to kind of give us a quick introduction on herself. And also we have Preeta Singhal, who's a nutritionist with MyAva. The reason I'm happy that we kind of looked at a combination of somebody coming from the medical fraternity and nutrition, because both of these do play some kind of important role in the management of headaches and migraines. We look into causes for headaches and migraines. We look into possible solutions, how to diagnose whether you have a simple headache or a migraine. We look at different types of migraines. So all of that is something that we'll dwell into, but would love to kind of introduce Dr. Impana and get her onto the speaker's table. And if you can just start with a basic introduction about yourself and give us a quick, thorough, kind of introduction on the topic as well.
Sure. Thank you, Evelyn. So I'm Dr. Impana. I practicing in Apollo BGS Hospital myself, and it's been like 10 years of journey as a practitioner itself. I'm an association with Apollo. It's my 6th year. So throughout my practice, I have done both the OPD, IP, online, and teleconsultations, and now it's a great experience. And yes, health talks is one of our activities that is necessary to provide you awareness about anything related to the health. Okay, so thanks Evelyn for this opportunity. So today's topic is, I would say that all of you should relax. Okay, so it is headache itself is a symptom. It is just a symptom. Okay, it is not a disease itself. So when you get a headache, you don't have to panic. You will get headache for everything under the sun, and it will range from the simplest thing that you should not be bothering to something that you should not ignore. So we will look into things that you should take it simply, and something that you should pick up and consult your doctors. So I told you headache is a symptom. So first of all, when a patient comes to us with a headache, we try to find out the cause. Okay, so always the treatment of the cause itself is the treatment for the headache. And then there are two types of headache. We call it like primary and secondary headache. So what is a primary headache? The primary headache, the problem is in your head, like the anatomy of your head. You have a brain, meninges, and you have blood supply, nerve supply. Any problem in your head to these anatomical parts will cause headache. That is a primary headache. You don't have to go and search anywhere else. Okay, compression of nerve and inflammation of the temporal arteries, like arteries, and all these things that happens. It's a primary headache. Okay, there is no proper reasoning for this, but it can only be treated symptomatically. Okay, now secondary headache is something that happens as a part of an infection. You have an infection like sinusitis, cold, tooth infection, you have an ear infection, Okay, your eye infection, anything in and around the face, you have an infection, or you have something like a swelling or a cyst or an abscess or a tumor, or all these things are the things that will cause headache secondary to it. This is called secondary headache. Head injuries and glaucoma, refractive errors, all these are the primary problems, but the headache, it happens secondary to it. Okay, so and also the headache is so simple that when you have loose motions or dehydration, the body loses lot of electrolytes and lot of fluid, that also results in development of a headache. Okay, so we're now coming back to the types of headache. So primary headache could be presented as a migraine, or a tension headache, or a cluster headache, and idiopathic headache or exertional headache. So exertional headache is nothing but your stress can cause a headache, your excessive working schedule can cause a headache, your all time tensed, or do you say the type 1 personality, anxiety, all these things can cause a headache. Okay, and migraine itself is a different topic. I'll come to that later. Okay, and also you have some hemorrhages. When we come to the secondary type of headache, there is systemic infections, the blood infections, and head injuries, vascular disorders, that is inflammation or infections of blood vessels, subarachnoid hemorrhages as in you have some swelling in the blood vessels that ruptures into your cerebrospinal fluid cavity, some meninges, and also brain tumor. So, and now what are the things that you have to understand to pick up or take it serious when you have a headache? So when you experience a headache, if your headache, you feel like this is the worst headache you've ever had, okay, this type of headache, you never had it in your life, that time you have to approach your doctor. And if you have some worsening of headache, like slowly it started and it gradually worsened over days and weeks, and it is not at all regressing, then you have to go for your doctor. Then you have a headache, then you start feeling that your eyes are getting blurred, you are not able to speak. Okay, your headache is associated with weakness of your limbs, legs. These are abnormal neurological problems. Okay, and you have headache associated fever. Okay, unexplained fever associated with headache. Then you have vomiting preceding a headache. This is very important, especially blurring of vision and vomiting. These are the symptoms that there is something happening inside your brain that is increasing the intracranial pressure in your brain, that has to be tackled immediately. If not, it will become life-threatening. Okay, and any headache, it is aggravated by moving your head sideways or coughing, you're bending or lifting weight, then you have to take it seriously and immediately go to the doctor. And any pain, that headache that disturbs your sleep, okay, any headache that worsens on awakening in the morning, okay, then you have to go to your doctor. Any systemic illness, even hypertension can cause the headache. You have high BP, low BP, both of them will present as a headache. Okay, so if any headache that is severe and the onset of headache is after 55 years, associated with local pain, like associated to one point of pain, when you press here, it is very tender or painful. All these are the serious signs of headache, what you call the red flags of headache, that you have to take it seriously and go and seek the help. Okay, so there's no confusion with understanding the red flags of headache. So these are the red flags of headache. Right. So now coming to this what do you call migraine, I'll go in detail to the migraine. Okay, so migraine is a primary
Doctor, just one thing before we switch into migraine, is there any basic difference between a headache and a migraine, and how does one differentiate if they have a simple headache or it's a migraine?
Yeah. Okay. Yeah, please go ahead.
No, we just wanted to understand the difference between these two, and like what is it that specifically one can do to understand whether they are having migraine, because as I understand it, migraine seems to be something which is neurological and it can be hereditary as well. So how does one understand that if they're having migraine or they're having a simple headache?
Okay. Okay, I'll make it very simple. So I was speaking about varieties of headache. That's what it is, a very huge topic. So headache could be of many types. So keeping headache and migraine, I would only tell about migraine, not about headache. Headache means we have many types of headache. So how do you identify migraine? So I was coming to that. So migraine is always, you will have unilateral headache. Okay. And you'll have always, some of them will have a positive family history. Okay. And migraine, you have a aura, or like when you're exposed to loud sound, there's a trigger factor for migraine always. Okay. So there will be a trigger factor. It could be a glare, it could be a flash of light, it would be a noise, it would be a smell, it would be a exercise, it would be a hunger. Some people will get it during physical contact or physical activity, like sexual activities, and some changes in the pressure. If you're going from high altitude to low altitude, or low altitude to high changes in the barometric pressure. Okay, when there is fluctuation in the hormone around your menses. Okay, and again, when you're consuming a lot of alcohol, caffeine, lack of sleep, all these things are the trigger factor for migraine. Okay. So migraine has always trigger factor with it. Okay. And it will also have an associated factor. You will have vomiting, and you will have nausea, vomiting, then photophobia, lightheadedness, scalp tenderness, visual disturbance, and altered sensations. You will have vertigo, you have syncope. Sometimes migraine is associated with seizure. You will have confusional states, you will have diarrhea. All these are associated symptoms with migraine, whereas the other headache will not have this. Okay. So what would be a diagnostic criteria for migraine itself is that you should have repeated attacks of headache ranging from 4 to 72 hours. Okay, with a normal physical examination. Okay, at least there will be associated factors like unilateral. One is unilateral pain, and it is associated with nausea, vomiting, photophobia or phonophobia. It aggravates with movement of your head. Okay, so this is how you identify a migraine. I hope I'm clear with this.
Absolutely, yes, doctor. Yeah.
Yes. Okay. So this is the very basic thing for migraine. Is normally we start with the symptomatic treatment. Okay. The major part here, like you said, you have a nutritionist here. Okay. Apart from that, lifestyle changes is very important in migraine. Okay. You should, first of all, you should identify the trigger factor. What is causing migraine? Whereas if it is some non-modifiable factor, is that a positive family history. Okay. If you have a family history and you have migraine, obviously we cannot modify that. What can you modify in migraine? The trigger factors. You know when and where you are exposed. You have to avoid the trigger factors. Identify the trigger factors, avoid the trigger factors. Okay. And then have a good lifestyle. You should have regular, healthy nutrition, good food. Okay. And then you should have regular physical activities. Okay. Early morning walking, jogging, yoga, mood stabilizers. Okay. And mood stabilizing activities you have to do. You have to keep yourself fit. Okay. And the third thing is, how do you first of all, reduce the level of stress? How do you see? We cannot avoid stress problems in our life, but how we respond to it, we can change. So try to build planning things that you will handle things in a very less stressful way. Okay. That you have to figure it out yourself, probably. Find logical solutions, meet your doctors, meet your guide, meet your superiors, discuss with your family, mingle. You should have more of social gatherings. You should have a good social life. Okay. And having a good mental health is another thing that will help you to deal with all kinds of headache, especially the primary headache. Okay. That you don't have any disease, but you have a headache. If you want to tackle that, have a good mental, social life, and also healthy body. That is the one thing that you can deal with this headaches where it is coming without any reason. Okay. So apart from that, obviously, how do we treat a headache? First of all, you have to identify a cause. If it is because of any disease, then we will treat the disease. If it is not because of any disease, we'll counsel you, we'll give you symptomatic treatment. Okay, and if you're not responding to that, we'll see we will evaluate you. First of all, any headache that has been chronic, we will do a scanning. We'll do CT scan, MRI scan. If we feel you need a CSF analysis, we'll do CSF analysis. If we feel that the headache is because of your changing power in the eyes, we suggest you to go to the ophthalmologist. Okay, and also we'll test the pressure in the eyeball. Glucoma is another reason where untreated glucoma might present as a headache. You have to treat the glucoma. Okay, and also you should see cardiovascular hyper blood pressure or low blood pressure. Okay, and you'll also see whether you have renal problem, like any renal failure, increasing creatinine, urea, causing uremia, ammonia excess in your body, can also present with altered sensorium and headaches. So all these things we will screen step by step based on your history, based on your presentation, and based on that we will plan the investigations, we'll plan the approach, and we'll give you the treatment. Okay. So I think to summarize this is the thing, and I think I'm open for the questions from your side.
Sure. So that was very informative, Dr. Impana. Just a couple of questions. I know we're having a lot of questions coming in the chat box, but just to kind of elaborate a little more on the diagnosis part of it, right? Especially because since you were mentioning that there are so many different sorts of headaches, right? And it might take some time before you actually come to a diagnosis of why, or probably, you understand why you're facing these headaches, right? What is the causative factor? So in this case, is there something that a person can do before they meet a doctor to actually identify if it's a trigger factor, if it is related to your vision? Sometimes you might just have like a vision related issue, right? Maybe you are probably due for a ophthalmic consultation and that is causing a headache, right? So how does one identify the cause before they meet a doctor? In the primary phase, and then what happens once they meet the doctor? How does a doctor diagnose why the headache is occurring?
That's what I summarized it in the last. I told you a series of tests. See, all these tests are not done. Like all the thing I have mentioned, we're not going to do that.
Right.
It's highly impossible for the patient to identify. See, if a person knows he has migraine, he knows it. Right. Now I told you what are the trigger factors. I told you what are the associated problems in the migraine.
Right.
Okay. You will be able to relate to it. Next time it happens, you'll be able to relate to it. Suddenly, now what you should know is only very simple thing. The red flags, what I mentioned earlier.
Right. Got it.
If you have like worsening headache, worst headache of your life. Okay. You have vomiting, nausea. And all these things are the red flags. It is only sufficient for you to identify the red flags.
Got it.
Come to the doctor, and remaining is headache of the doctor. Okay?
Right.
You don't have to take any headache. Now, if you cannot sit back and think what I'll do, I'll go, what test. This is very impractical. It's not your job.
Right.
Okay. What you should know is whether this is headache. How many days you have this? If the headache is only for 2 days, 3 days, chill. You have a fever, chill. Take medicines, you will get cured. You have a dental issue, go get treated, it gets cured.
Right, yeah.
Okay, so it's as simple as that.
Right.
Okay. But if you feel, okay, I'm working, I'm just having headache. It's been like past 3 months, I'm constantly having headache. Okay, it could be a primary headache. You don't have any illness. Okay, it could be because of your stress. So these are very simple things. There's nothing hard and fast for you guys to remember, recollect, and worry about. Okay,
Right.
just know the red flags, meet the doctor. Any investigation has to be done, anything to be evaluated, they will take care.
Got it. Okay, understood. So I'll before I switch into Preeta's contribution from the nutrition side, I'd just like to take a couple of questions coming in the chat box, right? Sushil Kumar is asking, ma'am, this is Sushil suffering from headache since many years. Usually it starts with blurry vision, vomiting, and then there is pain in the head and the neck. What is the suggestion that you would give Sushil, doctor?
He's like suffering since many years. It's very bizarre. Like many years, and since is he having headache every day, or he has not consulted anyone? Okay, first of all, he has got blurring of vision, vomiting is something is to be considered very seriously. He has to go and get one MRI scan. Okay, should go and get a CT brain or MRI brain. Go get that and test your vision. Okay, test your blood pressure. Okay, get a. I hope it's also important to know the age. What is your age? Okay, and are you a smoker? Okay, all this is when you go to a doctor, will evaluate everything. Okay, and then you will be given treatment. Okay, so I would suggest please go consult your doctor. Let them take your history and do the analysis.
Got it. Right. Understood. So just one more question. Would be more interested to know how to get instant relief from migraines. Asking this.
Yes, instant relief. There are medicines for migraines. You see, there are triptans, sumatriptans. You cannot. You have to definitely go and get a prescription. For acute migraines, we have tablets. Please keep that with you. When you have acute attacks, please take it. And also there is prophylaxis. We'll also give prophylaxis for migraine. Also, suggestion I give you to avoid migraines: lifestyle changes, good social life, good mental life, good work life. You should have everything balanced. Try to be more happy and relaxed. Okay, and have good food. What Preeta will suggest. Please have nutritious food. Everything is the root for happiness. Food, not only medicine. You should concentrate on everything. Okay, and then why migraine is associated? It is associated with nausea. It will cause, because it will. Actually, what happens here? It mainly affects the vessels, blood vessels. Okay, and then vessels in the brain. So probably that usually causes raised tension in the brain that. Causes nausea, vomiting, photophobia, everything else will come. So that is also another factor to identify migraine. Okay. Now it's also a very broad statement, since we're talking about migraine. There is nausea, vomiting is associated with everything, all disease. Okay, but when you have a headache associated with nausea, vomiting, one-sided headache, then it's a migraine. You have a trigger factor, you have an aura, you have a positive family history. Now that is a indication that you might be having migraine. So how to avoid headache and aura? I told you to avoid identify what is causing that. You avoid that, then you will avoid it. Okay, and I think.
There's somebody else again who's asking, my wife has severe migraine, consulted many neurologists, did an MRI of the head. Everything seems normal. It triggers because of many reasons. One of the reasons is acidity. Thinking too much, and how to control it, please suggest. Right?
See, mental illness is one thing which actually causes acidity. Depression is a thing that will cause everything. Okay. When you're stressed, when you're having mental illness, and when you're having migraine, can also in turn cause, like, people are pissed off migraine, they go into depression because they cannot get rid of it. What happens? There is release of steroids in your body, and there is release of excess acid in your stomach. That's why you end up having acidity. When we screen, there's no problem, but what you have to identify here is the stress level, the depression, or the whatever is bothering your mind. Okay, so work on that. Okay, the solution is how many questions you asked me, is the solution is the same. Right. Good food, good physical activity, good mental health, good social activity. All these things collectively, when you do it for long period with the medicine support, plus or minus medical support, will help you to cure this permanently. You have to make this as your life habit.
Right. Doctor, on that topic, is there any specific correlation between menstrual cycle in women and migraines? Any specific?
Yeah, not everybody all of us have menstrual cycle. All of us doesn't have migraine. It could be one of that. Okay. If someone is getting during it could be one of that. Hormonal imbalance, ladies taking frequent contraceptive pills. Okay, they will also have migraine because the contraceptive pills have the side effects of blocking the blood vessels. which cause thrombus formation. So in young females, so we always ask them to use barrier contraception rather than going for medications, hormonal supplements. That will also play with your causing hormonal issues, and then you'll start having migraines.
Got it. Understood. All right. So quickly, just moving into, since we just spoke about acidity, just moving to Preeta and just understanding from the nutrition perspective, Preeta, like how can acidity kind of trigger this, and how does one avoid kind of reaching that stage of extreme acidity and that leading into a headache or a migraine?
I'm sorry.
Yeah. Just Preeta, doctor. Yeah, Preeta, go ahead.
Yes. So, see, like doctor already explained, there could be different causes of acidity, right? One of the most common causes when we talk about food and lifestyle is that you are eating in a hurry, or you are either skipping meals or eating after extreme prolonged timings, right? So that can lead to acidity, plus trigger foods. Trigger foods are common for everything. Even there could be some trigger foods which can lead to acidity per person. So you will have to first identify what is your trigger food basically to avoid getting into that acidity zone. And then also you will have to eat your foods extremely slowly, chew it very, very properly because there are some people who eat in extreme hurry. We all are working people and we all do not have a lot of time to spare. And currently we see that most of the people do not even spend 10 minutes in eating. They'll eat it as soon as possible. And so we all have to understand one thing, that there's a role of teeth and saliva in our body, right? So if you directly eat the food and do not chew it or break down your food properly, it will not get digested properly. That will of course lead to acidity and acidic issues in your body, right? So that is one of the these, and of course stress. There is a strong connection between gut and your brain. So any stress, any depression, any anxiety, any overthinking will definitely lead to acidity.
Mm-hmm.
So there are these 3 things that needs to be avoided. For some people, dehydration also causes acidity.
Mm-hmm.
So these things needs to be avoided such that you do not get into that acidic situation. And then if acidity is a trigger factor for you to get into migraine zone, then you will be able to prevent that.
Right.
And I would suggest everybody who has acidity or in general migraine, you should maintain a food diary for yourself to identify what is your food trigger. For example, for somebody, cucumber could be a food trigger. For somebody who's gluten intolerant, can get migraine because of gluten itself, like wheat or rye or barley or something like that. So maintaining a food diary would be very, very helpful.
Sure. Right. So that was helpful. I think Snigdha had asked a question on the same thing. So Snigdha, that is the answer basically. Just make sure that you have a food diary and you understand the connection of what you're eating and what is causing that migraine attack. One more question, doctor, by Victor is, he says, I'm advanced stage migraine detected by a neurologist and headache specialist. He's been suffering for almost 10 years now. And there is no treatment in allopathy as such. Medications are nerve relaxant, which also slows down the speed of blood flow, and then pain suppressants. So he's just asking what are the other suggestions that you would like to give him, since he's been suffering for it for almost 10 years.
So I told you, he's there. I would want to know from him, has he put the efforts in terms of nutrition, lifestyle changes, avoiding the trigger, okay, not getting frequently obsessed with the persistent problem. These are the things that they have to focus on. If they are not focused, only depending on medicine will not help anyone.
Right.
Okay. And it is applicable to all types of disease. May it be a non-communicable diseases, communicable diseases, and we see patient as a holistic. You have to take care of your nutrition. Again, I'm telling you, nutrition, mental health, acceptance, response, and then the treatment, sticking to strict diet and a good lifestyle, and then comes the medicine. Okay. So unless there is some organic issue, something like visible changes in the brain or visible, you say a tumor or a cyst or something treatable, treatable cause is detected, then it is treatable. If otherwise, all what will help you is your good lifestyle, nutrition, especially what the nutritionist was saying, Water is the simple thing. Most of us during summer or when we are dehydrated, when you have a headache, please go and drink water. 3 liters of water. I would say don't drink a plain water. Have some electrolyte with it. Okay? Especially in summers when you're dehydrated, have an electrolyte rich water. Okay, glucose or electrolyte added water. Okay, that will help you to get rid of your headache. It's a very simple thing.
Got it. All right. So this is a very interesting question by Kanchan. She says, how do we software engineers avoid headache because of huge screen time?
See, there was one slogan. Okay, 20 minutes. It's not a slogan. It's just that sitting 20 minutes is equivalent to smoking and drinking. It will cause side effects as good as a smoker and an alcohol can have. Okay, I used to tell in my health talks that if you're sitting in your desk, after 20 to 25 minutes, get up from your desk, go around your desk, go and speak to your colleagues, have a cup of water and come back.
Right.
Okay, always your sitting angle. So you have sitting angle, the desk and the chair angle. I think in all corporates you have to manage that. You should have an anti-glare. Okay, if you don't have an anti-glare, get a specs, an anti-glare. This is a simple thing. I think all of you will know it. Only thing is you're not following it.
Right.
Okay, so all these things has to be done.
Yeah, I think moving around, eating great food, and kind of just having a better mental health, especially glad that there is so much focus on mental health these days. I think a combination of all of this and having the patience with yourself and in your body to kind of show the results. So almost all of us want just quick results, like do things for 2 days and expect the result out of it, right? So I think that kind of doesn't work every time, right? So Dhaval has a question specifically on the kind of medication, but Dhaval, I'd suggest that it'd be better if you kind of consult doctor directly, because this question is very specific to the medication that you're taking. So you can kind of reach out to Dr. Impana and kind of get a suggestion on that as well. We'll take just 1 or 2 more questions, Dr. Impana, and would like to also kind of focus on a couple of more topics. So Anubhuti says, though she takes medication, pain goes away after 2-3 hours and normal paracetamol doesn't work. So do you mean pain comes back after 2-3 hours? I think that's what she meant. And the paracetamol doesn't work with headaches.
Yeah. Same happens with me also.
Okay.
That's what you have to. There are other medications we have. Okay, we have triptans, amitriptyline, we have paracetamol, propanol, we have like a lot. You have to be in follow-up. You should have a case history with you. Be in follow-up with your family physician. I would suggest please go. If you like what people do, they just take medicine, grab medicine, they disappear for 6 months, they disappear for 1 month. They don't turn up. We don't know anything. Again, you would come back.
Right.
Okay, it should not happen. So keep in follow-up with your family physician.
So what would be the frequency that you would suggest of follow-ups?
Yeah, see, maybe monthly once.
Okay.
Must be okay. Monthly once must be okay.
Okay.
And if you don't have any problems and if you don't have any issues, also you can visit 3 months once minimum.
All right. Okay. Understood. So, doctor, just on the other side, there are some people who are completely averse towards medication, right? They try to kind of use all the natural ways and methods to kind of evade headache or migraines. When does it become necessary to take medication that, you're now at the stage where you're harming your body by not taking the medication? Is there a stage that it reaches as such?
Yeah, see, all acute migraines where you're vomiting, you're throwing out is something that you need medicine. You should go and get admitted, stabilize yourself, come back with a prophylaxis medicine. So I told you, even for it applies same. All red flags, signs you experience, it applies. That's it. There's no other thing. Keep these things in mind. Go and get treated. Okay. When you have acute attacks, definitely you need medicine.
Right. Just the last question, Dr. Impana, does sitting in AC cause headache? Because most of our offices these days are centralized AC and everybody.
See, it might see that it goes. Not everybody are intolerant. If you are having it, yes, then ask for a change of location. Okay, within, or you have to discuss with your whatever boss. Okay,
Right.
if you're intolerant to AC. Okay.
Right. Got it. All right. So just
Everything-
yeah.
I'd like to add one thing here that
Sure.
there has been some recent study saying that sitting in ACs can lead to dehydration
Okay.
because people do not feel thirsty. So
Hmm.
might be that could be one connection. There has been still research going on, so we do not clearly know about it.
Right.
That could be one connection.
Right. So the idea is to just keep yourself hydrated through the day, even if you're not feeling thirsty. Just kind of cover those 3 or 4 liters of water every day.
Yeah.
Right. So, Preeta, again, just coming back to you, do you have like those 4 or 5 things that everybody should definitely exclude from their diet? We know, like, we're looking at, say, coffee or chocolate. Usually, that is what people talk about, right? Or kind of avoid these things if you want to avoid migraines. Is there a list like that? Is it true that, by avoiding these things, you can kind of evade migraine?
Like what I usually suggest and say is that there's no one thing that can lead to, proper relief, or that can lead to completely, you can avoid the risk of migraine. There needs to be a holistic lifestyle so that you can avoid the risk. And there are few food triggers which are known to trigger people. For example, like we spoke about chocolate, right? So it contains a substance which is called as phenylethylamine, okay? And it also contains caffeine, which affects the blood flow in the brain, and that can lead to migraine. Now, for few people, it will trigger and lead to migraine, and stopping controlling on chocolates might help. Similarly, for caffeine, like drinking half a cup of tea or 1 cup of tea will not affect, of course, but somebody who's having 4, 5, 8 cups of tea, they will definitely see a relief in migraine in case they reduce the quantity of caffeine, right? Because it's a stimulant and will affect the blood vessels of the brain.
Right. Got it.
So that needs to be avoided. Then the third point I would come to, third food that I'll come up to is monosodium glutamate, which is mostly found in Chinese foods, right?
Right.
And
Ajinomoto, what we call these days.
Ajinomoto, yeah. So they're found in sauces also, the Chinese sauces that we get nowadays in the market and everything. They stimulate the receptors in our nervous system, and they can also trigger. So that is one thing. Then there's ice creams. Most people they also get triggered when they have ice creams. Reason being, it's so cold that they get into a brain freeze zone. And they constrict our blood vessels. And then that can lead to migraine headaches also.
Okay. All right.
So, and one more point for people who have diabetes also and also get migraine is aspartame, which is an artificial sweetener, right? That can also lead to migraines. So that needs to be avoided in case the person is having a lot of that. Aspartame as a sweetener, and also this aspartame has been found in various packaged food also, like breakfast cereals or gelatin or yogurts or desserts. So these needs to be avoided, but it all depends from individual to individual. Something like chocolate might suit somebody and might not suit somebody. For example, if I talk about myself, I can totally have caffeine and that will not trigger migraine in me. But then there must be somebody for whom caffeine is a trigger point, because for a lot of people, caffeine also increases or decreases the blood pressure. So that again, there is a connection between, like doctor had already mentioned, that there's a connection between BP and migraine also. So that might also be a reason.
Correct.
So these are individualized. Try to not overdo on any of these things. Try to control on everything and maintain a holistic lifestyle. That's going to help.
Right. Correct. Just quickly, if you can also elaborate on the nutritional deficiencies, because we're looking at almost 90% of people these days have a vitamin D deficiency. Everybody's been sitting at home and working, no sunlight exposure at all. So does that have an effect, or any other thing, like not only vitamin D, but we're looking at the other nutritional aspects also. Does that have an effect on migraines?
It does. Nutritional deficiencies definitely does have an effect on migraines. Nutrients like vitamin B6, B2, B12, vitamin vitamin D. B12 and D are the most common ones which are getting tested, and we get to know that they are deficit. And then in terms of minerals, there's folate, magnesium that have been associated with headaches. Research has proven that. So I usually recommend everybody to get tested. Okay, on, like for example, if you have magnesium deficiency and if you're not even getting tested, you can still include brown rice or whole grains or pumpkin seeds in your diet, so such that your magnesium levels are maintained, right? For vitamin D and B12, it not only affects migraine, it affects a whole lot of things.
Right.
Okay. So I think those are extremely important for everybody to get tested and for everybody to take supplements if required for that. And I guess Dr. Impana would be better person to explain about the supplements and how much of doses that needs to be taken.
Right.
So these definitely have a role in terms of nutrients, and diet needs to be rich in, carbs. It should have carbs also. It needs to be rich in nutrients that are there. You should have omega-3 fatty acids in your diet, and you can get it from fish, nuts, or seeds. Diet should not be very high fat, but should have good fat. Like you can include seeds, nuts, or some particular fruits which have good fat in it. That needs to be included. And I also suggest fresh fruits and vegetables which have good amount of water in it, because it will not lead to any kind of dehydration, right? So that's gonna help.
Sure. So Dr. Impana, just on, since Preeta was mentioning about supplementation, right? So this is something that we've commonly faced from all, since we're a women's wellness platform, a lot of women come and tell us that I don't want to have medication, right? And they think that supplementation is also something that's going to cause side effects, right? One question is, how does one, kind of get out of thinking that, supplementation is again medication that is going to cause side effects? And second, there is a lot of these over-the-counter supplements that are coming in today in terms of these gummy bears or probably these tablets or something that have been advertised as candies, right, for vitamins. How safe it is to take such kind of supplementation which is just bought off the counter?
I would say get supplementations prescribed.
Right.
If you're asking me, people are getting in gym. They're just like some private franchise selling it off. If you ask us, we have no answer for that.
Right.
Because we have no research papers. It's not FDA approved. Okay.
Right. Yeah.
You go to a doctor, get a prescription from them, buy it and eat it.
Right.
We have seen that in my hospital, I had seen one case where a gym person who was taking supplement had come up with a renal failure.
Oh gosh.
Okay. So now we cannot go into depth of it, but what I say, get a prescription, valid prescription, take those.
Yeah.
Okay. And other than that, please, you have natural foods available. Nothing is a supplement is not better than the natural food you eat.
Right.
Okay. And that has to be balanced. Okay. You have to take a balanced diet every day. That will balance your nutritional need. Okay.
Right.
2 egg whites per day. 2 glass, especially for females, 2 glass of milk per day, 2 egg whites per day, mixed fruits, mixed vegetable. Okay. Making protein a major part of your diet along with some portion of carbohydrates. You can get a customized. Now we have a lot of dietitians. You can go and get a customized diet if you're not able to plan it well by yourself.
Right.
Okay. Moreover, when you're physically active, you have good oxygen circulation in your body. Okay. More hemoglobin formation in your body when you're active. You sit in a good ventilated area. Okay. All these things you have to keep in your mind. So it will keep you more active, less lazy. It will keep good oxygenation in your blood, good blood supply, and also all these things helps you to synthesis good erythropoietin synthesis. Happens, and then you will have good blood maintenance also along with the good nutritional support. So these are the natural things. When you do it on a regular basis, it will be maintained. Now, if you still want to go to supplements, then please get a prescription.
Right. All right. So I'm just going to take one last question from Bhavya. So she's saying, I'm a new mom and I do not have proper sleep at night because of her baby. And she's having varied sleep patterns. Recently, I've noticed that when I bend down, I have slight pain or pressure in the forehead region. I suppose this is a symptom of migraine. How do I prevent this?
I think you should now. That's what I said. The bad thing is everything will feel that, oh, something is said and I have it. You should let go of this attitude. Okay. I think you have the answer yourself. You're a new mom. You have stress. Okay. Relax. That will help you. I have the answer. You fail to identify the trigger factor you have. You are a mom. You have lack of sleep. Okay. Migraine is not important. What is you are undergoing? You are undergoing stress. So don't try to identify migraine. Identify the problem that is causing you headache. Migraine is just a label. Okay. Right. So please identify your stress levels in your life. Identify what you're lacking. Please try to meet that. And then if you're not able, after doing that, you're not able to get help, come to the doctor. Okay.
Right. Absolutely. So, doctor, any parting, kind of pointers that you'd like to give all of us from the, medical side of things, that these, maybe if you can just give us a recap on the red flags that we're supposed to be looking out. People joined in a little bit. Yeah.
So I saw one question here about the Levitil. I want to give little clarification.
Sure.
I heard, as per your line, you had a seizure. Please, when you have already had a seizure, it is important for you to be on anti-epileptics. Unless otherwise you're seizure free for certain period, you should not stop it without advice from your neurologist. Okay, Levipil is good if you are taking on long term, you're not having any side effects, that is okay. But if you're taking for long term and if you're experiencing some difference in your body, then you have to go and change the tablet. But getting off anti-epileptics will cause you recurrence of seizure. So do not stop without medical advice. Okay. And red flags. Going to the red flags, first is that this should be the worst headache of your life, that you have not experienced this headache ever. If you have such headache, if it is worsening from little bit of headache on day 1 to it is for days, 2 weeks, it is been constant and it's not getting better. Okay. When you are having headache, you're having neurological deficits, as in blurring of vision, inability to move hands, weakness of your limbs, inability to speak, all these inabilities you start having, it's a red flag. If you have a fever and you have a headache that is triggered by a fever, okay, and you have headache, before headache you had nausea, vomiting, blurring of vision, these are the signs of pressure in your brain. Okay. And some headache like which is there for long term, and it is usually every day it is there. You don't have any stress factor, you don't have anything, but you're lifting, you're coughing, you're bending, it is there for very long term. When you're doing these activities, you're getting. Okay. If you have lack of sleep every day, for again, one day lack of sleep is not a problem. Okay. You're having disturbance of sleep for ages and you have associated the headache, and you have disturbance like as soon as you get up early in the morning, you have a headache for like so many days, you're experiencing this. Again, number of days becomes important here. Okay. And again, you have some systemic illness like glaucoma, teeth problem, ear infections, nasal infections. Okay. You have high BP. Okay. Get treated. Okay. And if anybody above 55 years of age on oral contraceptive pills, okay, suddenly having headache, please go and meet your doctor. Okay.
Right. Fantastic. Thank you so much for that recap, Dr. Preeta. Anything from your side that you'd like to mention from the nutrition side of things?
Yes, what I would suggest is that make sure you're not skipping your meals, or you are not delaying your meals a lot. Make sure you're having on time and you maintain a time of eating your meals every day. And if you are prone to acidity, or if you know one of your trigger is not having meals on time, then make sure you are having all your meals at every 2 to 3 hours. Number 2, what I would suggest is involved in some kind of physical activity, be it yoga, be it running, jogging, dancing, whatever you like, because it will de-stress you, number 1. And number 2, it will also help your body overall. When you are physically active, it helps you. Number 3 is do not let dehydration happen, because that will trigger your migraine and might lead to various issues. Number 4 is get yourself tested as soon as possible. If you know you have migraine, if you've spoken to your doctor and the doctor has told you have migraine, you should get all your vitamins and minerals tested, get your lab test done, and then act accordingly. And please don't fall prey to those crash dieting or any form of dieting which is not healthy. Do something that is sustainable. Our Indian meal is wholesome and will provide you with enough nutrients if you are eating it properly and if you are maintaining all your carbohydrates, protein, fats and everything. And also sleep on time. Maintain your body's biological clock. It should not be like what usually happens with people, teenagers or people who are working, is that they sleep at 2 a.m. and then they wake up at 6 or 7 a.m. That becomes a problem, because when you're not sleeping properly for a very long period of time, it's going to affect you somehow. Doctor also covered these points, but I'm just reiterating on the same thing.
Sure. Absolutely. I think it's just holistic, kind of living and concentrating on all aspects of your lifestyle, which can kind of resolve a very tiny, but something that really troubles you, right? It's a very tiny thing, getting a headache, but it really kind of disrupts your day-to-day living, right? So, thank you so much, Dr. Impana, for making the time out, which is kind of coming towards the closure of the session. So thank you so much for taking the time out for educating us on headaches, on migraines, and also providing like possible solutions. It's always wonderful to see doctors also suggest like a complete holistic, kind of approach towards things, which actually kind of makes a difference for the long term, right? So thank you, Preeta, also for joining us, right? And kind of sharing your tips and tricks with nutrition. We will definitely kind of share more tips on, kind of Onsurity or MyAva's website. You can always download the MyAva app if you're a woman suffering through any chronic conditions. If you're looking for support from a community, do download the MyAva app. We're on Play Store as MyAva, MYAVA, and you can also join the community there. So thank you so much once again, everyone, for tuning in, and we'll meet on the next Wednesday with a new topic and with a new focus. Yeah. All right. Thank you so much. Thanks, Doctor. Thanks, Preeta. Thanks, Komal.
Thank you.
Thank you.